Hello and welcome to today's presentation, Medicare 101 with Karen Nelson. My name is Tina Hall with Era Living, and I am delighted to host today's presentation. Now, before we get started, I'd like to share just a little bit about Era Living with you. As many of you may already know, Era Living is a local family-owned and operated collection of 8 active retirement communities, all located within King County, founded in 1987 with Ida Culver House, Ravenna. All Era Living communities are appropriate for active, independent seniors who are interested in health and wellness programs, social engagement and involvement, and of course, lifelong learning opportunities. All Era Living communities also provide assisted living services to our residents who may want a little extra help, but still want to enjoy this active, engaged lifestyle and the variety of amenities Era Living communities offer. Some of these amenities include beautiful garden spaces, well-stocked libraries, exquisite dining opportunities, art classes, lecture series, and much more. Best of all of our communities have warm, friendly, supportive employees ready to help our residents feel at home. I encourage you to reach out to Ida Culver House Ravenna at 206-523-7315 to learn more about Ida Culver House Ravenna or Era Living, or just retirement living in general. We would welcome the opportunity to offer you a tour or just to answer any questions that you might have. And with that, it is my great pleasure to introduce Karen Nelson. Karen has been in the Medicare insurance industry since 2012, and she has her life and disability insurance license in Washington, Oregon, and Idaho. Karen was an inaugural member of the Humana Broker Advisory Council, and she is an active member of the Senior Care Coalition, as well as several other senior advocacy groups. Karen brings a wealth of information and experience, as well as a passion for helping people to the table. And with that, it is my great pleasure to turn it over to you, Karen.
Thank you so much, Tina. That's a great introduction. I appreciate that. Welcome, everybody. As Tina said, I do have a passion. I could talk Medicare for hours and hours and hours, and I won't bore all of you. I'll try not to. I'll try to keep this as interactive as possible and to provide as much information as I can and do it as simplistically as I can for you. Just to reiterate, if you do have any questions, you want to interrupt me at any point in time, feel free to reach out into the chat, and Tina can get me, stop me as I'm going down my little train, and we can get those questions answered for you. And I also like to do presentations that are a little bit more interactive, and I like to make sure that everyone's on the same page. So there are going to be some times where I'll go ahead and talk about something, and then I'll just double check and make sure everybody's on the same page and understands what it is that I just shared. Okay, here we go. I'm going to share my screen with you. I like to do these presentations and take some information directly from the source. So I am going to share with you, we're going to go to the Medicare NU book. Not sure if all of you have received yours yet this year, but I like to do my talks directly from it. So if you have a Medicare NU book, you can follow along. You can look at it later on, because that's what we're going to do, is go directly to that page. So I'm going to scroll down here. And what we're going to discuss, we're going to kind of talk about, a lot of you I'm sure have been on Medicare for a while. Some of you know how it operates, some of you don't, but we're going to go through the nitty-gritties of it. So when you are on Medicare, Medicare has several different parts and they can be confusing. So we're going to go through each of them. So initially, you have Part A for Medicare, and that's your hospital. We basically just say hospital as a whole, but it actually encompasses a few things. You can see right here on the list, it says inpatient care while you're in a hospital. It also covers skilled nursing, hospice care, and home health care. But our really quick little, when we talk about A, B, C, and D, we say Part A, hospital coverage. Your Part B is your medical coverage, or sometimes we just refer to it and say the coverage that you'd use when you were seeing a doctor. But it does encompass a little bit more of that. And you can see here on the list, there's the services from your doctor, outpatient care that you might have from the hospital, home health care is covered under it, durable medical equipment. So if you need to have a walker or a wheelchair or maybe an insulin pump, that's also considered a durable medical equipment. That's covered under your Medicare Part B. And some medications are actually covered under Part B, and we're going to talk about that a little bit. So A and B, A hospital, B doctors, and your Part D for drug coverage. You'd be surprised how many people don't realize D stands for drugs. It's your medication coverage. When you originally transition onto Medicare, you get your Part A and your Part B. Part A, provided that you have worked the equivalent of 10 years or 40 quarters, you've already paid into the system for Part A. So your Part A coverage, you're not going to have a cost. But your Part B is going to come in at monthly cost. That cost this year, we're looking right around the $150 range for your Part B coverage. And that is give or take a little. So if you are low income, you might not pay the full Part B amount. If you have a higher income bracket, you're going to pay more on your Part B. But the average person, that cost per month on Part B, it is right around the $150 a month that you're going to pay for that. So when you have Part A and you have Part B, some folks like to say you have an 80% coverage. So it kind of sort of is an 80% coverage. It's not exactly. There are copays and deductibles with both Part A and Part B. Depending on what insurance coverage you have that goes along with your Medicare, you may or may not ever even realize that you had any deductibles or copayments with your Part A or Part B. But we'll talk about that a little bit later as well. So your approximate 80% coverage with your A and B, and then you need to have a Part D. You need to have a prescription drug plan. For some people, they may have a penalty with their Part D because they didn't get it when they should have. You have a time duration in order to get your parts to Medicare. And if you didn't get your Part D when you should, unfortunately, the penalty you have will carry with you always. Unless the government decides at some point in time to be nice and kind and let that penalty go away. But most people, if you get it right in the same time frame that you should, your Part D, you're going to pay a premium for your Part D coverage, and then co-pays and maybe some co-insurance with your for your prescriptions, depending on what medications you're going to take. We're going to go through and dissect that a little bit more as we go along. So Part A, hospital, Part B, doctors, Part D, drugs. So I'm going to open that up to questions real quick. Everybody on the same page with me, or does anyone have a question? We're good? Okay. For a couple of you that have your video on, I can see what I really like about that is I can see if I see the puzzled look on your face or if I can see you nodding or shaking your head. So that actually, that helps me a lot in my presentations. If I start seeing a little bit of confusion happening, I'm going to slow down and go back through something a little bit clearer for you, okay? All right, whoops, let me get back to here. Went a little too far for me. Okay. Let's backtrack a little bit. Okay, let's talk about what our options are. Some of you may or may not even know you have options. You know, we have this busy time frame coming up, the October 15th through December 7th. That's called annual enrollment period. We'll talk about the different time frames here shortly. But during AEP, you have an opportunity to review what it is that you have and make any changes that you might want to have. So talking about the differences here might be really beneficial for some of you. When you transition onto Medicare and you get your Medicare A and B, you have two ways of getting your insurance coverage to help you with those out-of-pocket costs. Again, you have deductibles with Part A and B, but after those deductibles are met, then it does become the 80-20 rule. And if you don't have an insurance plan in place, you're going to be on the hook for 20% of the remaining costs that Medicare won't pay for. So let's look at the two ways that you could get your coverage. Okay. The first one we're going to talk about is original Medicare. Okay, that's having your Medicare as primary. So you're going to have your Part A, you're going to have your Part B, you're going to add a Part D, and then you can add a supplemental coverage plan or a Medigap plan, or it's also called a secondary sometimes. Premiums for those are going to run nowadays. They're a little bit expensive for that gap plan. So we're looking at around on average of $220 a month. You're still going to have to pay that Part B no matter what. So that monthly cost for Part B, you'll always have to pay no matter which direction we go. Which direction we choose as far as your coverage goes. But the supplemental can be a little bit expensive, but there's a reason why some people will pay that price. So let's talk about that. So Medicare would be your primary. So if you were to go in and have any services done at the doctor's office, at the hospital, Medicare is going to be the one who says whether or not that service is covered. Okay. And the rule of thumb is if it's medically necessary, it is going to be covered. So a lot of people get a little scared and they say, oh, Medicare is not going to pay if I have cancer. Not true. Okay, as long as it's medically necessary, whatever services you're having. Now, unfortunately, Medicare is not going to pay for a facelift, although a few of my clients have tried. but as long as, again, if it's medically necessary, Medicare will cover its portion, and your Medigap plan can come in and pay the remaining amount. So Medicare would pay its 80%, and your GAP plan, depending on which level of coverage you choose, could pay the entire remaining 20%. So you could go into the hospital and have a very long hospital stay and still not have to pay anything more than what your premiums are each month. Okay, does that make sense? You get your Part D separate, okay? Your prescription drug plan comes separate, and that's also at a cost. Remember, we talked that that's going to have a premium to it. You shop your Part D depending on what your needs are. So currently in 2021, we have a prescription drug plan that monthly premium cost is $6 and change. They also can go up to $100 and change. So they're going to vary. The plans are going to vary. The formulary of each Part D plan is going to vary. And that means the level in which they see those medications. Medications are on a tier system. Tier 1 and Tier 2 are your less expensive medications, and they go up to Tier 5. So all of the Part D plans that are offered each year in our state, they all have a different formulary. So you want to shop your Part D plan every single year because the plans will change and your medications can change during the year. Okay. So far, everybody on the same page? Okay. All right, so when we have this particular direction of getting our coverage, again, we said Medicare is going to be our primary. So whatever it is that you do, that secondary doesn't have a choice. If Medicare has approved that service, that secondary has to come in and pay those remaining costs. Sometimes I'll get a phone call from someone and they'll tell me that their plan didn't pay for their service. And sometimes it's a coding issue. We just work with the billing department to make sure that gets taken care of. But if Medicare denies the service, and we've checked and made sure that the coding was done correctly, but it was a service that Medicare doesn't cover, your secondary is not going to pay that remaining amount, okay? Because it is your secondary. It pays the remaining that Medicare does not. So as long as it's an approved service, the secondary will take care of it, okay? Now, in the state of Washington, we have some rules that are very different than the rest of the United States. And one of those rules is that you can change your Medicare supplement or your Medigap plan anytime you want to during the year. You don't have to do that during our AEP timeframe. Now, your prescription drug plan, that's the time frame to shop your prescription drug plan, that October 15th through December 7th, and whatever change you make takes effect January 1. But your Medigap plan in the state of Washington can be changed anytime you want to. The insurance commissioner here in Washington state really likes consumers, and he says that it's your right to always shop around your plan and make sure you're getting the best price for the plan that you have. And so there are times where I'll get a phone call from someone who may be paying $300 a month for a plan that another carrier is going to offer the same exact plan for $220. And that can be a significant savings for folks. So know that any time of the year you have that opportunity, if you have a Medigap plan, to change your Medigap plan. Okay. And again, your Part D, you do want to do, that's annual. The only time frame to change that Part D, unless you're in a special election period, which we'll talk about, generally the only time to change your Part D is this October 15th through December 7th timeframe. And don't let anyone ever fool you. There are a lot of agents out there that will tell you, oh, this is the plan that you want to be on. And they'll tell you that without even asking any information from you. Don't listen to them. The only way to shop your prescription drug plan to find the best one for yourself is to utilize Medicare's website. So if you know how to do it, you can always go to medicare.gov and do it yourself. You could call Medicare and they would help you shop your plan. Or if you work with an agent who's reputable, that agent is going to ask you for the prescriptions that you're taking currently. They're going to want to know your dosage and your frequency of those medications. And they're going to plug it into Medicare's system. And Medicare's algorithm is going to shoot out and let us know which the best Medicare Part D plan is for you during that current year. Okay. And we don't have visibility of any of that until October 1, and officially can't make any changes to your plan until October 15th. So I'm just going to share that with you. If you get those phone calls from people who say they can do it for you now, unless you're in a special election period, those agents can't do that for you right now. Okay. Unfortunately, there's a lot of agents out there that are just trying to make a buck, and they're trying to do it the wrong way. So I like to make sure that you all know what the rules are. When you have original Medicare and your Medigap plan, you can go anywhere you want to that accepts Medicare. It's not a matter of asking if they take your Medigap plan. It's asking if they take original Medicare or Medicare assignment. Okay. You have no network. You don't have to ask permission. If you want to go see a specialist, you get to go see a specialist provided they take your Medicare plan. Okay. Excuse me, provided they take original Medicare. Okay. You may want to consult your doctor because you might want your primary in on the conversation saying, hey, I think I want to go see a cardiologist. But if you want to make that appointment outside of without talking to your primary, you have availability to do that. I learned a lot about things throughout the years as just utilizing, working with my clients. Sometimes I get those kind of questions that I am not sure what the answer is. So I do a little bit of looking up to try to figure out and provide that answer to folks. And something I learned a few years ago, I didn't know. So I'll share with you. If you go in to see a specialist and you'd like to have a second opinion, if you have original Medicare, you can go get a second opinion. If the opinion that specialist gives you is the same as the first, you got to choose one of the two of them to move forward with. You can't go get a third opinion. But if your first opinion and your second opinion are different, you can go see a third specialist and Medicare will cover that. Okay. So second opinions are good. Third opinions are only good if the first and the second differ. Make sense? Okay. Original Medicare, again, you don't have a network. So if you were to move out of state, your plan would go along with you. And it would work the same in any other state as it does here in Washington. Now, changing that plan might be a little different depending on the state. But here in Washington, like I said, we can change that Medigap plan anytime we want to. It's not true in every state. So if you're working with an agent and you're going to move out of state, make sure you talk to your agent so they can look up the rules for you in your new state. Okay. But if you're traveling and you're going to go see some grandkids or anybody else in your family or just going off with some friends and something happens to you in another state, again, your plan is going to work the same in that other state as it does here in Washington. Medicare is your primary and your Medigap would be your secondary. Okay. A little more expensive on that one, but it is a really nice way to get your benefits. Some people really like it, especially if they're in and out of the doctor's office or maybe have surgeries coming up or may potentially be in skilled care, because again, you're going to pay for your monthly premium. You can budget a little better with that than you can the other direction we're going to talk about here shortly. Okay, before I move on to talking about Medicare Advantage plans, or otherwise known as Part C, do we have any questions on that, on Original Medicare? Hi, Mike.
Hi, I have a question about Part D.
Sure.
Could you explain the differences between the multiple tiers that they have?
Yeah, so there are 5 tiers, okay? Tier 1 and Tier 2 are going to be your generics and preferred generics. And then as you go up with your 3, 4s, and 5s, those are going to be your brands, and your more expensive medications, maybe like a chemotherapy medication. Okay. So most doctors are going to try and prescribe your Tier 1 and Tier 2 medications because they know that they're going to be less expensive. Your Tier 3, 4, and 5, no matter what Part D you're on, are going to come at a higher cost. Tiers 4 and 5 are typically those really expensive medications that you're going to have to pay a percentage of rather than a copay. Most Part D plans, they're all going to vary, but most of the Part D plans, your copay for your Tier 3 is going to be higher. Most of the plans, your Tier 3, 4, and 5 medications all fall under the umbrella of having a deductible. Most of the Part Ds don't have a deductible with your Tier 1 and your your Tier 1 and Tier 2 medications, but the deductibles usually come into play with Tiers 3, 4, and 5. Does that make sense?
So I'm using a generic. It's rated as Tier 3, and it's 700% higher than the Tier 1, which it used to be.
So this is a really good example, Mike, of shopping your plan from one year to another. So just because it's a generic doesn't mean on the formulary in which the plan it is that you have actually lists it as a Tier 1 or Tier 2. Okay. We can't say every single generic is going to be a Tier 1 and Tier 2. Depends on the plan that you're on. And they can change. You can have a Tier 3 medication one year on the same carrier, and the next year it could be a Tier 1 or vice versa. Okay, the plans have availability to make that change, which is why we encourage people to shop their plans from one year to another.
You know, I've compared it with other plans, and they also have it as Tier 3. Every one I looked at, so I don't know.
Yeah, so then it's looking at you know, the deductibles, looking at your, you know, what your upfront cost is. Do you shop your plan every year?
Yes.
Okay, good. Smart man. Yeah, you always want to do that. And you also can get a little creative on getting your medications. And I, as an insurance agent, have to be very careful what I share with you. But I do get phone calls from my clients on occasion when they do get an expensive medication and they say, help. And we help try to figure out an alternative to what they can do, what some options are as far as getting that medication at a better cost. Okay. Hope that helps without me crossing a line.
Yep.
Okay. All right. Any other questions on the original Medicare side before we move on to Medicare Advantage? Okay. So let's talk about Medicare Advantage plans, or Part C as they're known. So if you look here, you're still going to have your Medicare Part A. You're still going to have your Medicare Part B. Again, don't forget, you're always going to have to pay for that Medicare Part B monthly cost. But most Medicare Advantage plans, we can't say all of them, but most of them all include a Part D in the mix with their Medicare Advantage plan. Okay. And then you can see it says on this page, it says some extra benefits. And that's a true statement. With Medicare Advantage plans, most all those Medicare Advantage plans have extra benefits that you do not get if you're on original Medicare. And those extra benefits can be some extra dental, they can be some extra vision, some extra foot care, maybe transportation. There's a variety of different things that the plans can offer. Okay. One of the big differences, well, there are several, but one big difference with Medicare Advantage is you're no longer looking at Medicare as your primary. Medicare Advantage plans are offered by individual insurance agencies, okay? Those insurance companies, they're private. And one of the nice things about each of them that I see is the fact that they each kind of want to offer some different benefits because they each want to try and entice you over to them as far as utilizing them for business purposes. And so some of those benefits can be really nice on Medicare Advantage plans. But you have to remember, Medicare is not your go-to. It's the individual insurance company who's going to give the approvals. So whereas we said with original Medicare, you don't have to ask permission, you do when you have Medicare Advantage. So typically you have a primary, and then you need to get a referral to go see a specialist with your primary. Not all plans will say that, depends on the plan you have, but majority of them, you do have to get a referral. And typically when you have a service, the doctor's office is making phone calls to the plan to get approvals to have, say you have an MRI scheduled. They're just getting that approval from the insurance company. Now it's a very, 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 very rare occasion that you would ever have anything denied. Sometimes it just takes a little bit of time to get that approval. I have one out of the box situation with one client that I have had in the number of years that I've been an agent. And yes, that goes back to 2012. And I only have one client. And again, it's a very out of the box situation that she's been denied for. And I can't tell her that her particular carrier is the only one that would deny it. That service is probably going to get denied no matter which carrier she had. And I really don't know if original Medicare would pay for it either. So that basically tells you that you can still have your services done when you have Medicare Advantage plan, okay? So it takes your Medicare Part A and your Part B and your Part D and combines them all together, and you pay one price. Whereas on original Medicare, you have one cost for your Medigap and another cost for your Part D. You could have a zero as far as your monthly cost goes on a Medicare Advantage plan. Some people really like that. If they're not utilizing their insurance too often, if they're pretty healthy, staying out of the doctor's office, why not? You can have that coverage, including your Part D, and not pay a monthly premium. No matter what Medicare Advantage plan you have, you're going to have copays and co-insurance, and you have a maximum out-of-pocket amount when you have those plans, okay? A lot of plans have a zero copay to see your primary, because they really want to encourage you to be able to get to the doctor's office. Nobody wants you to be told that they can't afford to go to see a doctor. So a lot of plans are having a zero copay to go in and see your primary, but you'll have a bit of a higher copay when you go see your specialist. And again, you're going to have some co-insurance. Co-payment is a solid amount. Co-insurance is a percentage. So sometimes we don't know exactly what that amount's going to be because it's 20% of the cost. Well, whatever that cost is, 20% of it is what you might pay, depending on what the service is. Does that make sense? Okay. Medicare Advantage plans really are wellness plans. They really encourage you to get into the doctors and get checked out before anything actually happens. They want to do those screenings. So all of your colonoscopies, your mammograms, all of your preventatives are going to be covered under that Medicare Advantage plan at a zero cost for you, because they do want to get you in and they do want to check out and make sure everything is going good. And if they catch something, well, great, they caught it and hopefully caught it early enough that, things can get taken care of the right way. So let's talk about some of those extra benefits. There are some plans out there that have a zero monthly cost and actually have some dental benefits that go along with it. Again, if you have original Medicare, Medicare doesn't look at dental as an important factor for health. I don't know why, but they don't. But the Medicare Advantage plans, a lot of them do have dental benefits with them. And like I said, some of them will cover some vision benefits. Maybe you need to get some glasses. That Medicare Advantage plan might have some coverage for you for getting those glasses or contact lenses if you wear them. Some hearing benefits. Some of the Medicare Advantage plans actually have benefits that you can get a hearing aid if you need them. There's a few carriers that offer transportation. For some folks, they can't make it to their medical appointments. And there are a few plans out there that have that as well. They do have a maximum out-of-pocket amount. I want to tell you that there's a difference between a deductible and a maximum out-of-pocket. So traditionally, when we were working, most folks had a PPO plan. And in that plan, you had to meet your deductible before certain services were covered. On Medicare Advantage, it don't work the same way. The Medicare Advantage plans say you have a maximum out-of-pocket amount. So you have all your copays and your co-insurance. You'll be paying on those services that you have until you reach the maximum out-of-pocket amount. And once you meet that, the plan will take care of everything 100%. Some of those maximum out-of-pocket amounts can be quite high. I am here to tell you that most people don't even come close to the maximum out-of-pocket amount on the plan, okay? So sometimes people look at those plans and they see that there's a strong value with the fact that all the extra benefits they're going to get and the very low cost up front. And as they utilize their plan, they might not even pay what it comes to looking at the premium on a Medigap plan. Because as we said, those Medigap plans, we're looking at about $200 to $220 a month. Okay. Medicare Advantage plans, there are some that are zero. There are some that have a premium to them, and the plans are all going to differ. And just like those Part Ds that we talked about, that October 15th through December 7th, that's the same time frame to take a look at your Medicare Advantage plan and see if the one that you've been using is the best one for you for this year. Or maybe you want to make a change from a Medicare Advantage plan and move over to Original Medicare. You have that option as well. And I do have some folks who look at the costs that they've been paying on their Original Medicare and want to transition over to a Medicare Part C. You have that option during October 15th through December 7th. It's really smart to look at the variety of factors, one of which is your medications. No matter what, if you have a Part D or you have a Medicare Advantage plan, the cost of your medications is going to differ between all the plans, okay? When you have Medicare Part C, you want to look to make sure that your primary physician accepts the plan. Don't ever let anybody put you on a plan and just say, oh, this is the best one for you, without looking to see whether or not your doctor takes it. Okay. Any other questions on Medicare Advantage? Oh, I'm surprised nobody asked me this. They are network-based plans. So you do have to stay within your network when you have a Medicare Advantage plan. Okay. Remember we said you have to ask permission. Not all networks are the same. So again, don't let any agent turn around and tell you that, oh, this is the best one. You need to look at whether or not your physician takes it, find out what hospitals they accept, see how your medications are on the formulary for that Medicare Part C, and see whether or not you'll utilize some of those benefits that are on there. Okay. All right. I'm surprised there's no questions. Usually I get questions. So let's see, let me glance at this really quick and see if there's anything I missed that I think you cannot live without. I think we've covered a good portion of stuff. Oh, foreign travel. Let me mention this on foreign travel. Anytime you are traveling outside of the country, I'm going to bring our screen back. Anytime that you are traveling outside of the country, you want to make sure that you have a travel plan. Okay. No matter what Medicare plan you're on, Medigap plans will pay some emergency foreign travel. Don't let that fool you, thinking that they're going to go ahead and cover everything for you. They won't. So just make sure you pick up a travel plan if you're outside of the country, no matter what. So let's talk briefly on special election periods. So I'm going to bring our screen back up to this here. So special election period. So we talked about AEP, annual enrollment period, and that's October 15th through December 7th. You can change your plan as many times as you want to during that time frame. So if you talk to one agent who talked you into this, and then you talk to your friend who showed you this great thing that they have, and you want to make a change and take that, you can do it. You can change as many times as you want to during that window, October 15th through December 7th. But the very last thing that Medicare sees in the system for you at midnight, December 7th, and yes, I have had an 11 o'clock night at the phone call on December 7th at 11 p.m. for somebody to quickly change my plan. The last thing Medicare sees in the system, midnight, December 7th, is what you will have moving forward January 1. Okay, that is AEP. So we have something called OEP. I'm only going to touch on it briefly because I'm not allowed to advertise it, but I want you to know. So OEP, if you look through your Medicare and U book, or you were pretty savvy and you went online to take a look to see what you could find, OEP is what we call open enrollment period. That is an opportunity to anyone who is on a Medicare Advantage plan currently and wants to make a change, you can do a one-time change to another Medicare Advantage carrier if you'd like to, or transition on to original Medicare. Okay, that's January 1st through March 31st. The first 3 months of the year is what is called OEP. So sometimes we make a choice during AEP and maybe find out that the doctor doesn't take that particular plan, or medication that you were on is not going to work really well with the plan that you're on, or you decided that you wanted to give the Medicare Advantage plan a try. Or unfortunately, I've had it happen where somebody gave information to an agent and they changed the plan without their knowledge and put them on a Medicare Advantage plan. You have those first 3 months of the year to make that change, okay? OEP. It's a little different than AEP. You cannot change your prescription drug plan during that time frame. Unless, however, you have what we consider a special election period. That's an SEP, okay? And an SEP, special election period, would be maybe moving from one state to another. Or you can also trigger an SEP, say you had a long hospital stay and ended up into rehab. If you go into a skilled nursing, that has opened you up for a special election period. Now, why would that be a benefit? Well, typically when you go into the hospital and then you have to transition into a skilled nursing, sometimes your medications have changed. So that could change in the formulary that's on your plan. It might not look so good. You have an opportunity to make that change. There's a 2-month time window after you come out of rehab that you can change your plan. You have a special election period. Now, for some communities, some senior communities that offer a lot of nursing, depending on the level of care that that particular community offers, we might be able to trigger an SEP all year round. All depends on where it is that you're living and what services are being provided. And there's a variety of other SEPs. I tend to get a lot of phone calls. I tell people, if you need to change your plan, if something has happened, call and ask. If there's an SEP that I can trigger for you to get that plan changed, if you need it, I'm going to do everything in my power to get that to change. Sometimes I have to tell people they have to wait until October before they can make that change. Okay. Question? Any questions? That was a lot of information. Okay, is there anything that anybody has wanted to ask? Whether or not it is anything that I spoke of today or any situation that has come up that you have a question on? Sure, Sheila, what you got? Oh, gotta unmute you. Can you unmute yourself?
Okay,
There you
am I undone?
There you are.
Oh, great, thanks. Karen, I have a Medicare, I have a Medicare supplement. And
Okay,
I've had it for a number of years, 5 years, and I go to Arizona in the winter.
okay,
And it seems as though there's nothing to be worried about right now because everything seems to have the same coverage when I come and go.
mhm,
I spend 6 months here and 6 months there.
okay.
But when you mentioned a special election period move from one state to another, if I decided to move to Arizona, would I have to do something about that? Or am I going to be good to go just like I am now?
So you'd want to look, if you want to keep your Medigap plan, you can keep that. That's fine. I would recommend doing a price comparison if you were going to move,
Okay.
because not all states operate the same way. So here's one thing to know about Washington. We have one price in general across the board. So Humana is going to offer one price. United Healthcare is going to offer one price. Mutual of Omaha is going to offer one price. But when you go to a different states look at your age, your gender, your county, perhaps. Depends on what state you're going to. There's a lot of factors into the price that so Humana is going to have 10 different prices depending on your gender or whether or not you smoke. So you kind of want to look before you move and say, okay, what I have currently in the state I have, is this going to be a good price, or would it be better if I change it when I go to that other state? You have an option, but if the other state's more expensive, hang on to what it is you have here. The one
Okay.
that you do want to look at would be your prescription drug plan if you decide to change.
I need to look at that. That's the most important critical.
I would, if you're going to go ahead and move outright, completely move, yes, you want to look at your prescription drug plan because those are going to be different between the states.
Okay, okay, thank you. That's good to hear. And I
Yeah.
can keep the same representative that I have, right? Even though he's in Washington?
As long as he's licensed in each state, yes.
Okay, great.
As long as an agent is licensed in the state that they're writing the business, you can keep your agent.
Wonderful. Thank you, Karen.
You're welcome.
Love your, this is very interesting. Thank you.
You're
Full
welcome.
of information. Thank you.
Thanks.
Yeah.
So along those lines, let's talk about that real quick. An F plan is an F plan is an F plan. A G is a G is a G. G as in gopher. There was a rule in 2020, January 1 of 2020, anyone who was newly eligible for Medicare after January 1, 2020 was no longer entitled to an F plan. That F is in Frank. That was what we looked at as the top Medigap plan. And then G we looked at as the second top plan. Well, now for anybody who's new to Medicare, they don't have rights to get an F plan. They have to get a G plan. What I like to tell people, the only difference between the two is who pays the Part B deductible. Remember we said Part A has deductibles and so does Part B. Part B has an annual deductible. Once your annual deductible is met, then it works with the 80-20 rule. And so G, the G plan, the Medigap plan G says you will pay your deductible yourself. And then after that, the insurance company will go ahead and pay everything that's remaining outside of Medicare. The F plan says that the insurance company will pay your deductible and then you'll have your 80-20 rule. Now, why would somebody choose an F over a G just in general? And to me, that's price. F plans are very expensive. And now we don't have any more new business coming onto an F plan because most people, those newly coming into Medicare, even if they have rights to an F, a lot of them are choosing the G because the monthly cost is a lot less. And it really is more cost efficient to just pay your deductible yourself rather than paying what I like to say, a service fee to the insurance company to pay the deductible. Because if you do the math, you're paying them extra for them to pay that deductible for you. Okay. So the thing that you do want to know is across the board, again, an F is an F is an F. And to Sheila's point, they're taking care of everything. It looks really good. Well, that's because that's what they're supposed to do. And it wouldn't matter what carrier you had. They have to do everything via the federal government, which says that the F plan takes care of everything. The G plan is going to take care of everything except your deductible. And there's a few other variables. There's a few other plans that are offered as well. Some people might be familiar with the N plan, N as in Nancy. There's a little bit of difference as far as how much that costs and the different things that it takes care of as well. Hope that helps, Sheila.
Thank you.
Yeah, you're welcome.
How many different types of plans are there, Karen?
There's quite a number. As far as the Medigap plans are concerned, I do believe there's like 8 of them, I want to say. I tend to only write 3 of them. I write the F, which I don't really do a whole lot anymore. I write a lot of G plans, and I write the N plans. As far as things are concerned, as of right now, those 3 plans really give you some very, very strong coverage at a very good price per month. Medicare made that change and took the F plan away. Some of you may remember the J plan. J as in Jack. We had a J plan for a long time. And I believe in 2010, that one went away. So Medicare makes some changes here and there. As far as anything that's coming new down the pike, I haven't seen anything yet. And cost-wise, that would make me veer away from writing the F, the G, or the N at this point. Some of the other plans are good plans, but there's too many out-of-pocket expenses as far as I'm concerned. And I want to make sure that my folks are covered as best as possible and not having to break the bank with their premiums. And as far as Medicare Advantage is concerned, let's just say there's a lot. Those plans are county-based. So between the counties, you're going to see a big difference. King County, Pierce, Snohomish, you've got 20, 30 plans available to you. If you went out someplace rural like Kittitas County, you have 3 plans available to you and they're all one carrier. So your options are going to be different depending on location.
We have a question. How much is the original Medicare annual deductible?
Oh, so your Part A deductible is $1,400 and change now. So Part A deductible is very interesting. So your Part A deductible is not annual. It's per benefit period. So when you go into the hospital and get admitted to the hospital, your, as I say, your ticker, your costs is going to start with that deductible. So you need to meet that deductible first. Okay. And then if you did not have any other insurance and you only had Part A and Part B, you have that Part A deductible, you have that Part B deductible, and then you're going to have that 20, that 80/20. Okay. But say you come out of the hospital and 4 months down the road, things are great, but 4 months down the road, something happened and you got admitted to the hospital again. If you didn't have that insurance, guess what? That Part A hospital deductible, you're going to have to pay that again. I will tell you by personal, I had a dad who didn't want to listen and decided that he was so healthy, all he needed was his Part A and his Part B until he wasn't healthy. And we had to pay that Part A deductible 3 times in a year. I did manage to get him insurance before we had any other issues, but that deductible came back and bit us pretty hard, which is why I have a passion to make sure people are covered really well. That deductible is not a fun one to have to pay multiple times.
So there's another question. Can you move back and forth between original Medicare and Medicare Advantage plans yearly?
Yes, you can. Don't ever let an agent tell you you can't. Yes, you can. And it's fairly easy here in the state of Washington. And just depending on what time frame it is that you're doing it, but no health questions are asked. There are certain carriers, I should say, if you're going to a Medigap plan, there are certain carriers that will ask health questions. So depending on the time frame in which you're doing it and what carrier, you may not have any health questions at all.
And your Medigap plan would cover your Medicare deductibles, yes?
Yes, it would, depending on which level you would have. Yes, it would cover your deductibles.
I have a question.
Sure.
Oh, good, you can still hear me. If I had a hospital visit, thank you. I was trying to unmute myself, but I guess I don't know how to do that with this, this particular Zoom. If I have hopefully not, but a hospital need in Tucson this winter, would that $1,400 be the same? It's per benefit period, which means how long is that? My question is, how long is that benefit period?
Yeah, I think it's a 3-month time frame. And if you have that Medigap plan, you don't have to worry about it. Your Medigap plan is going to cover it.
Oh, okay, then I missed that. Thank you.
Yeah. Do you know which plan you have? Do you have an F plan or a G plan by chance?
Darn, I don't have it in front of me. I'll go down and find it.
Do you ever receive a bill?
No.
Okay. If you never receive a bill, you probably have an F plan.
Okay.
If
that
you
sounds familiar.
Okay. If you
Yeah.
pay your deductible yourself, you probably have a G plan. And if you had a Medigap plan and you had copays, we're probably looking at an N plan as in Nancy. But if you have the F plan, you don't have to worry. Your deductible is going to be covered if you end up in the hospital.
Wonderful. Thank you. I don't have any copays at all.
Okay.
So, yeah. Thanks very much, Karen.
You're welcome. Any other questions? I don't know how we are on time, Tina. You know me, I could talk Medicare for forever, but you want to make sure we're.
It's about 3:20, so we still have time for a few more questions if anyone has some. It definitely sounds like there are a lot of options that people should really consider each year during that AEP.
AEP, you got it.
AEP, okay.
I taught you something.
All right. Does anyone else have any questions?
Yes, this is Peggy.
Go ahead.
I have a question about the, I came in late, so I apologize up front if you covered this. With you being an agent, the presenter being an agent, I understand that when you talk to the plan, you're talking to somebody who's got a definite investment in getting you there and the best things for them in the plan. For you, you're a representative of what? You're an independent insurance agent. So we would pay you to go over this stuff with us if we wanted to contact you?
So you feel free, you can contact me, absolutely. And I know Tina will have my information available for you, but you never pay an insurance agent anything out of pocket yourself. So whether it's myself or any other agent, if they're asking you for any money for any materials or anything with their time, that's not the agent for you. Okay. As an agent, we get paid through the insurance carrier in which we write any business. Okay, so my paycheck, my commissions would come directly from the insurance company. I'm a broker, I'm an independent, and so I write for many different carriers. I like to tell all the folks that I work with the stronger, the strongest carriers. I'll tell you the big names. And the reason why I choose to just write for those big names is because they're the ones that are going to give my clients the best of the best. So I'm going to, I maintain my certifications and all of my appointments with as many carriers as I see that would be of value to any of my. And if there's by chance, some off chance that there's something that I'll run somebody's medications through Medicare and see that it's not an insurance plan that I write. Sometimes, depending on the business, I can just go ahead and put you on that plan directly through Medicare, or I may have another agent that I know of that can write that particular business. And I might go ahead and say, hey, let's let so-and-so go ahead and write that for you. And we can still maintain that business relationship so that if you do have any questions, you have somebody to ask. But it's really important. I've seen it time and time again. I've heard that folks will ask for dollars for paperwork. Oh, I have this booklet. If you pay me X amount of dollars for this booklet, I have all the information for you here. Don't buy it. Okay.
No, I didn't mean to imply that the agents were asking for money. What I meant was when you talk to an agent from Humana, say, or from
Right.
United Healthcare, they're trying to give you the best information to get you to stay with them. That's all I meant. And I was thinking with you being an independent, that you would be looking outside of United Healthcare, outside of Humana, you'd be looking at an overarching kind of what's best for you.
Correct. So any agent who writes for multiple carriers, correct. They're going to be doing the right thing for you. But that's a very good point. If you make that phone call to United Healthcare is not going to tell you that, oh, you actually could get that medication cheaper if you were on this other carrier. They're only going to give you the information for that particular carrier. So you're right. United Healthcare is going to give you information from United Healthcare. Humana will give you information from Humana. And there are some agents that's all they do. They work with that one carrier, and they're a wealth of information for that one carrier. But yes, I work for multiple.
And did you go over and again, I'll listen to this offline, but I mean, I want to listen to the presentation again, but did you go over all the advertisements that are nonstop on television about Medicare?
I didn't, but you bring up a really good point. This year,
when a millionaire tells me he's getting $100 or $1,700 extra dollars a year, and I'm sitting here going, I can't get Part B paid for because I have to pay for that. That's kind of, it rankles me. And I did call once, and they said, well, if you live here, you have to live in this zip code, and you have to do all this. And it's just, it seems like somebody's spending a lot of money to do these advertisements.
Yes, you are correct. And I want to say dynamite, because that would be one of the commercials that does talk about it's called the Give Back program. Yes. And there are some states that do offer the Part B premium. They will offer you a portion or all of your Part B back, but you are correct. It's dependent on where it is that you live. So all of those commercials, they speak to the masses. They speak out to all of this. One of the things that's really important for people to remember in the world of Medicare is a federal program. So we have federal rules, but we also have individual state rules, and we have individual carrier rules. So there's a lot happen. And yes, those advertisements are out there just to, I hate to say this, but it's confusion for everyone, which is job security for me. But when you see those commercials, don't listen to everything it is that's on there. There's a lot of fine print on there. You should never shop your insurance based on what somebody's telling you on a commercial. Does that help, Peggy?
Oh, yeah, it was just interesting to me too. I actually called one and got the information, and that was when he told, you get all that information about the zip codes and everything. And then I decided I'm going to try another, because they're all different numbers. They're all different 800 numbers, because they're all in different call centers. And I said, where are you? And then I wanted to call about the plan, but I don't live in Florida, Arizona, or whatever. And he said, well, you're right. Then it wouldn't do you any good to go through this with me.
Exactly. And some of those can be a bait and switch, because
Yeah.
some of those, they're advertising one thing, but some of them will try and make a change with you over the phone. Honestly, like I wish they were illegal, but they're not. But
Yeah.
good for you
Yeah.
for calling and asking the questions and actually recognizing that wasn't going to be a value for you.
Good. Thank you very much. So we'll have this presentation will be available to replay, right?
That's correct, Peggy. We have recorded today's presentation and we can send you out the link just as soon as we have it available.
Thank you.
And it looks like we have one more question. It says, I think you started to tell us who the strong carriers were.
Oh, yeah, I'm not going to name it by name. We'll just say that I do make sure that my appointments and certifications are always within the main stronger carriers, those ones that offer the best benefit, not supposed to say best, that offer the strongest benefits at the best price for folks, making sure you have really good coverage and really strong networks. That's super important. Yeah.
Looks like we have one more question from Sheila.
Thank you. Am I still,
You're good.
I'm not muted. That's great. Thank you. I'll try and make this brief. Just recently, after 6 years of not having to make a copay, I had a little oncology or an ultrasound at a local hospital. I don't know if I should even mention the name, but it's never happened before that they said I needed to pay $21.20 up front. And I said, but I have Medicare and I have United Healthcare. And the lady said, you can either make the appointment and pay or not make the appointment. And I was between a rock and a hard spot. So I used my Visa number and paid the 21, which was not a lot of money. So now trying to get that back, which is not a big deal, but it's sort of a, like a little drop in your shoe. You want to take that out before you can move on. And so when I got to the bottom of it, I called everyone I could talk to. They said that Medicare didn't pay for the whole thing.
Here's your reminder.
Oops.
Webinar.
They didn't pay for the whole thing. They paid for $117 worth of a $300 procedure. And so the Advantage plan only picked up the other 20% from the 117, leaving a figure that Medicare wrote off. So I'm wondering how many times that's happened. But this now that the Advantage plan it takes a while for them to pay what they owe, then they can reimburse my little $21.
Oh, nice catch.
Odd or what?
Okay, yeah.
So that does sound kind of funny, but I don't think you said you had a Medicare Advantage plan. It sounded like you had a Medigap plan.
Excuse me, I'm sorry, I meant Medicare, a Medicare supplement.
And didn't you say that you have an agent that you work with?
I do.
I would call your agent and ask them to get to the bottom of it. They earn a commission. And so, he is your agent. So I would call him and have your agent work on that for you.
Thank you. I hate to have that happen again with a bigger figure. So it was a real surprise. Thank you. That's a good idea.
Mm-hmm.
Did we have any additional questions?
Go ahead, Mike.
Excuse me. I was wondering, how extensive are the insurance companies' networks? How do they go about setting it up?
So, some of
wonder-
them, they will change from one year to another. They definitely will change. I'm not supposed to tell you that I don't want to call them favorites, but I have my front runners each year, and that may change. And a lot of that's based on the upfront costs, the utilization of the plan, and then the network itself. So we do have some carriers, there are a few that it's on the Medicare Advantage side, it's a rarity for you not to find your specialist to be in the network, because the Advantage plan, the contracts with the physicians and the hospitals is very strong. There are some carriers that's very small, that they don't contract with a lot of the hospitals. So, but there are a few carriers that contract with Polyclinic, UW, Swedish Virginia Mason, all of them, all encompassing. So it's not like maybe say Kaiser. So Kaiser only contracts with Kaiser. So you can only see those Kaiser physicians and go to those hospitals that are approved by Kaiser. The standard Medicare Advantage plans are not like that. They're larger. The networks are bigger.
Could I ask one more question? A short one about whether you've seen any implications regarding COVID in terms of unvaccinated people being denied care, or are you getting any questions in on that?
Have not had, that is a good question. I have not had anybody who reached out to me to say that anything COVID related has not been covered.
So not necessarily that you have COVID, but that you are unvaccinated and trying to see a physician or something like that.
Have not heard anyone, there's not been one client that has called me and said that they've had any coverage denied, whether or not they were vaccinated or not.
Okay.
And Karen, we did have another question, and that was, what do you recommend we budget for Medicare related coverage on a monthly basis?
Oh, that is a really good question. It depends on your plan. So if you have original Medicare and Medigap plan in your Part D, again, the Medicare Part B monthly cost is, we're looking at that $150, $160 a month. Medigap plans, you want to average about 200. I usually tell people 225, 250 for that in your Part D. If you have a Medicare Advantage plan, if you're on a zero premium plan, I do tell people if you tuck away maybe $100 a month, you'll have a nice cushion if something is to happen to you. But I do have some folks that use a Medicare Advantage plan with a zero premium each month, and they don't have much of an expense at the end of the year. And I have had some, I did have a client who shared, was in the hospital twice on her particular Medicare Advantage plan, in the hospital twice with a variety of challenges. And the end of the year, her bills were less than $2,000 throughout the whole year.
Wow.
It's going to vary. It will definitely vary. It also depends on carrier.
Karen, we have a question. Can you share your phone number?
Sure. Okay. Are we ready? It's 206-650-8073.
Thank you.
Yeah, absolutely.
Now, before we wrap up, did we have any additional questions? That's been so helpful, Karen, just so much information.
Excellent. I am glad to help.
Well, everyone, if we don't have any more questions for today, I just want to say thank you. Thank you for joining us. I hope you got a lot out of this. I am delighted to share that I learned some new things. And we will be sending out some follow-up surveys to everyone just to get your feedback on what you thought and to get your ideas on additional types of presentations you might want to see. So we really appreciate it if you can fill those surveys out and return those to us as soon as you have an opportunity to do so. And with that, I think we're ready to let you all go and enjoy the rest of your afternoon. And I just want to say thank you again, Karen.
You're so welcome. I'm typing in my phone number there. There we go. Donna's just
8073. 8073.
Give you a second to catch that before I end the.
Oh, could you give me that number again?
Yeah, let's give it to her one more time before I end.
It's 206-650-8073.
8073.
I'm sorry, 206 650 what?
206-650-8073.
Thank you. Sorry about that.
Nope.
Thanks for sharing that, Karen. Appreciate that.
So much. That was very informative, Karen. Thank you.
Good. I'm glad. You're welcome.
All right, everyone. Have a great afternoon. And thanks again for joining us, everyone.
Alrighty, take care.
Bye now.
Bye-bye. Thank you.